The rectum, along with the sigmoid colon, is the most frequent site of polyps and cancers in the gastrointestinal tract. Adenomatous polyps of the colon and rectum have the potential to become malignant. The chance of developing invasive cancer is enhanced if the polyp is more than 1 centimeter in diameter. Removal of all polyps is recommended to allow complete histological diagnosis and exclude carcinoma. This is best done using endoscopic biopsy or snare polypectomy techniques. If one or more rectal polyps are discovered on sigmoidoscopic examination, a colonoscopy must be performed because further polyps are frequently found in the colon. The rectum shares the same spectrum of polyps as the colon. All rectal polyps should be biopsied or removed for histological analysis. A range of techniques can be used, depending on polyp size and location. The majority are less than 1 centimeter in size, benign, and are amenable to endoscopic polypectomy. Polyps greater than 1 centimeter in size have a 10% chance of malignancy. Endomucosal resection, EMR, and endoscopic submucosal dissection, ESD, are techniques to consider when use of biopsy forceps or a snare is not optimal. The resection plane for both EMR and ESD is the superficial submucosal layer.